This ancient technique can reveal what's going on in your body just by feeling your pulse. An ancient practice in traditional Chinese medicine has been pulse diagnosis. And if you see a TCM doctor, you'll have them feel the radial artery right here, right on your arm. Now, what the actual pulse shows to us is a few key things. Number one is what's going on with your immune system and what's going on with your resources. So for example, if you see a TCM practitioner and they're feeling your pulse here, they will often say your pulse ranges on a spectrum of very strong to very weak. When we talk about very, very strong pulses, we have what's called a floating pulse, which means that when you touch the radial artery with light pressure, you're feeling the pulse already. And it usually means one of two things. Number one is that you're actively getting sick and the body is pushing resources to the surface where there's the problem. Number two is that you're basically in a state of sympathetic dominance. So your body is overworking because you're underrested or you're pushing too hard. And so your cardiovascular system, your hormonal system, your adrenals are showing that as well. The second pulse that we see is what's called a wiry pulse. So again, you're seeing a traditional Chinese medicine practitioner, you might be on the table like this, they're feeling your pulse, and they're saying, we feel a wiry pulse. Wiry usually means sympathetic dominance, you're in fight or flight too much. Secondarily, it can mean issues with your liver or gallbladder, like you're having acid reflux, indigestion, a bitter or a sour taste in your mouth. And then finally, another pulse quality is what we call deep and weak. Weak pulses often correlate with like endocrine exhaustion. These are people who have chronic fatigue syndrome, chronic depression, clinical depression, they have hypothyroidism, or they've been chronically exhausted and worn down over years, sometimes by chronic illnesses themselves. So the pulse is an amazing snapshot for where the person's resources are right now.